It is crunch time for people who haven't finished their Christmas shopping, and it's down to the wire for those who still need to buy new health insurance, too. December 23rd is the deadline for enrolling in Obamacare if consumers want their new plans to take effect at the beginning of the year. It has been a rocky rollout. Peter Doocy has followed every twist and turn and has the latest on how things are going with healthcare.gov. Hi, Peter.
Hi, Shannon. And there might be about 15,000 people out there who think they're all set to be covered by January 1st. But they aren't, because the critical 834 form that healthcare.gov uses to give insurance companies very basic information about applicants never made it to the insurance companies for 15,000 people during the first 2 months of healthcare.gov. That is not good. So HHS now says this, quote, to make sure that no consumer falls through the cracks because of earlier pervasive troubles with the site, we are contacting every consumer who has selected a plan through the federal marketplace to remind them to pay their premium and connect with their insurer. Now, on Capitol Hill this week, there was a big bipartisan budget deal as well, and the top negotiators for each side sat down this morning to describe what they want the immediate future of the Affordable Care Act to look like.
No one wants to go back to the point of having our insurance companies decide whether or not we get health care or not. I'm rooting for us to be able to make this work.
I think we have to replace this law. I believe we can have a system in this country where everybody has access to affordable health care, including people with pre-existing conditions, without a costly government takeover, with more freedom. But we didn't yell at each other about this issue because we knew we would never agree on this issue.
That budget bill passed the House this past week. It is scheduled for a Senate vote this week. The Senate Majority Whip, Democratic Senator Dick Durbin, says he thinks about 8 Republicans in the Senate are going to need to support the bill for it to pass. Shannon.